Hi everyone. This is a presentation on a systematic review called The Effect of Vitamin D Supplementation on Blood Pressure in Adults. I'm Rebecca Iwata. I live in Tucson, Arizona, and I'm in the Master in Applied Nutrition program at the University of New England. The purpose of this systematic review was to identify and review research that has been conducted to determine if daily vitamin D supplementation administered for a minimum of 8 weeks had an effect on blood pressure among adults age 18 years and older. An introduction on hypertension. It is a health condition that affects over 1 billion people worldwide. The diagnosis of hypertension is a systolic blood pressure of 130 and higher and a diastolic blood pressure of 80 or higher, measured 2 different times on 2 different occasions. There's a lot of medical concerns that can occur due to having hypertension, such as vascular disease, cardiovascular disease, aneurysm, stroke. Some of the causes can be from medications, genetics, obesity, vitamin deficiencies, and different medical disorders. The treatment is usually pharmaceutical medications, but it can also be helped due to lifestyle changes such as physical activity, decreased dietary intake of sodium and processed foods, and quitting smoking if you're a smoker. Vitamin D deficiency has been identified in adults with hypertension, and researchers have actually studied the potential association between the two. So a little bit about vitamin D. It's a fat-soluble vitamin, and it refers to both vitamin D2 and vitamin D3. It can be attained through sunlight, food sources such as egg yolks, dairy, and fortified foods that have been fortified with vitamin D, such as cereals and flours, or supplementation in the form of a capsule or pill over the counter. To measure the amount in one's body, it's a 25 OHD is a serum measurement, and a concentration of anywhere between 30 and 50 is considered adequate for the general population. The recommendation for vitamin D every day is between 400 and 2,000 international units. And this depends on a lot of different factors such as your age, your gender, your skin tone, and your diet. So hypertension and vitamin D, what is the connection? There is a connection between vitamin D and hypertension that appears to come from the renin-angiotensin system, which is a signaling response that regulates blood pressure. So researchers have demonstrated that when there is a vitamin D deficiency, renin-angiotensin activity seems to increase, which actually increases blood pressure. So the PICO-T question that my systematic review was trying to answer is, does daily vitamin D supplementation administered for a minimum of 8 weeks affect blood pressure among adults age 18 years and older? So the PRISMA framework was followed for this paper. The databases that were used to locate articles were ProQuest, Synahall Complete, Cochrane, and PubMed. The inclusion criteria was specifically for adults in outpatient settings of any health status, research published from any country, study design preference of randomized placebo-controlled trials, study groups with at least 20 participants, research between 1990 and 2020, articles published in English, articles specifically looking at vitamin D supplementation for a minimum of 8 weeks, and articles measuring blood pressure as an outcome. The exclusion criteria were articles investigating children, settings other than outpatient, study groups with less than 20 participants, research published before the year 1990, articles not published in English, articles investigating dietary vitamin D, articles that were not looking at supplementation for a minimum of 8 weeks, and articles that didn't measure blood pressure as an outcome. This was the PRISMA flow diagram that I followed to obtain my final 30 articles that were included in the review. The articles were also graded by me for the quality and risk of bias using the Evidence Analysis Manual Quality Criteria Checklist for primary research, and they were only included if they received a positive or neutral grade. So the paper was broken up by several subheadings of specific articles that were similar. So the first subheading is vitamin D supplementation for adults with specific disease states. So in the first article, adults with HIV received either a placebo or 4,000 IU vitamin D daily for 12 weeks. No significant effect was measured between baseline and endpoint. The researchers did note that the participants had both baseline and endpoint low 25-OHD levels, and so further research is needed to see if perhaps HIV populations might require higher dosages of vitamin D. The other article here is adults receiving chronic dialysis. They received either a placebo or 3,000 IU of vitamin D for 3 months. No significant effect on systolic or diastolic blood pressure were examined here. The dosage of 3,000 IU vitamin D supplementation daily was able to replete the 25-OHD levels in the patient who at baseline were deficient, though. So vitamin D supplementation administered with another vitamin or medication. These specific articles here, these three, were all looking at vitamin D and calcium. So the first article, postmenopausal women, their blood pressure was measured at an annual PCP appointment for 7 years. They were receiving either a placebo or 1,000 milligrams calcium and 400 IU of vitamin D for 7 years. No significant effect on systolic or diastolic blood pressure was observed. Of course, something to note here is that 7 years is a very long time. Lifestyle factors, diagnoses, medications, things could have changed within that 7 years that could have affected these results. The next two studies were both looking at adults who were in weight loss programs. In the first one, overweight women in the program received either 1,200 milligrams calcium and 4,000 IU of vitamin D for 15 weeks. No effect on systolic or diastolic blood pressure was examined. In the next one, adults in China who were in their weight loss program received either 600 milligrams calcium and 125 IU vitamin D for 12 weeks. Similarly, no significant effect on systolic or diastolic blood pressure was measured. Vitamin D supplementation administered with another vitamin or medication. In one article, pregnant women who were at risk for preeclampsia received a daily multi-mineral vitamin D that contained 400 IU of vitamin D for 9 weeks. No significant effect was found. Adults with hypertension who received 2,000 IU vitamin D along with nifedipine for 6 months. No significant decrease was found here either in systolic or diastolic blood pressure. And then healthy Danish women who received only 20 IU vitamin D along with an estrogen supplement daily for 1 year did not find a change in blood pressure either between baseline and endpoint. Vitamin D supplementation administered with another vitamin or medication. In this first block, we look at two studies that were both conducted for 9 months, one with patients with Graves' disease who received 2,800 IU of vitamin D with an antithyroid medication. And then in the other study, we were looking at congestive heart failure patients who received 2,000 IU of vitamin D and 500 milligrams of calcium daily. For, again, both 9 months. The patients in the Graves' disease showed a significant decrease in central systolic blood pressure, but not in diastolic. And the patients with congestive heart failure did not show any sort of change from baseline and endpoint that was significant. And then adults with colorectal adenoma received either 2.0 calcium plus 500 IU vitamin D, 800 vitamin D, or a placebo for 6 months. No significant effect between systolic or diastolic blood pressure on the vitamin D group or the vitamin D plus calcium group was measured. Vitamin D supplementation with adults with low vitamin D. Adults with arterial hypertension with 25 OHD between or below 30 received 2,800 IU vitamin D per day for 8 weeks. No significant change here. Healthy adults with 25 OHD levels of less than 75 received 2,000 IU vitamin D for 12 weeks. No significant decrease here. And then adults with a plasma 25 OHD level below 50 received 7,000 per day for 26. And again, no effect was noted here. Vitamin D supplementation with adults with low vitamin D continued. Adults with very low vitamin D levels of 25 or less received either a dose of 4,000 or 400 IU of vitamin D for 6 months, and no significant effect on either group were found. Postmenopausal healthy women with 25 OHD levels between 10 and 60 received 2,500 IU vitamin D or placebo for 4 months. No significant effect was found here. 25 overweight adults, or 45 overweight adults with a mean 25 OHD concentration of 30 received either 3,332 IU vitamin D or a placebo daily for 12 months while they were in a weight reduction program. No significant effect was found here. Vitamin D supplementation with adults with low vitamin D continued. Pregnant women who were at risk for developing preeclampsia with levels less than 25 received either 400 or 4,000 vitamin D for 13 weeks gestation until 12 weeks postpartum. The group that received 4,000 of the vitamin D did have significantly less preeclampsia event compared to the group who only received 400. And then another study investigating HYD, which is a 25 OHD metabolite versus a vitamin D serum measure in postmenopausal women aged 50 to 70 years old with 25 OHD levels between 8 and 24 was investigated. The participants received either 20 UG of HYD daily, 800 of IU vitamin D daily, 140 HYD once per week, or 5,600 IU vitamin D once per week. They found that the treatment with HYD compared with the daily vitamin D lowered systolic blood pressure significantly, while diastolic blood pressure did not show a change. Vitamin D deficiency and disease process. Adults with heart failure along with vitamin D levels less than 30 received 4,000 IU vitamin D supplementation for 6 months. They did not see any sort of change. Adults with type 2 diabetes with 25 OHD levels lower than 50 received 6,000 IU vitamin D per day for 3 months and then reduced to 3,000 IU vitamin D per day for 3 more months. They did not see any changes here. A weakness to note in this specific study was that p-values were actually not included. Vitamin D deficiency and vitamin D supplementation administered with another vitamin or medication. Women aged 70 years and older with 25 OHD levels below 50 received either 600 milligrams of calcium and 400 IU vitamin D, or only 600 milligrams of calcium for 8 weeks. Found that compared to the calcium group, the vitamin D plus calcium group showed a significant reduction in systolic blood pressure, but not in diastolic blood pressure. The researchers did note that their study demonstrated that short-term supplementation with vitamin D and calcium is more effective in reducing systolic blood pressure, and they contribute the effect to the restoration of the parathyroid gland functioning back to normal. So a quick little discussion here. My results found that 11 of the 30 articles reviewed found statistically significant results related to blood pressure. The studies varied really greatly from one another. Most of the investigations did not find that vitamin D supplementation daily for a minimum of 8 weeks had a significant effect on blood pressure in adults. The findings suggest for future research that the minimum length of treatment should be no less than 8 weeks, and the dosage of vitamin D should be no less than 400 of IU daily. So there's some limitations here. Vitamin D comes from multiple resources, or multiple sources, such as dietary and the sunlight and supplementation, like we said, and your ability to absorb vitamin D is varies a lot. Your melanin in your skin determines how much of the sunlight you can absorb. Your BMI, because vitamin D is it's stored in adipose tissue. So if you have a higher BMI, it's harder to have bioavailable vitamin D for your body. Gender comes into play because women have more adipose tissue than men in general. And geographic location to the sun, so how much sunlight you can even get. And then your age, because when you get older, you actually lose the ability to absorb as much vitamin D and convert it into usable vitamin D for your body. One of the strengths here is that we had really clear results. We had a very clear statistically significant versus a non-significant result. We were able to look at those p-values very clearly in these studies. So for future research considerations, more research must be conducted to investigate more targeted dosages and differing lengths of treatment, along with specific geographic location and melanin in their subjects. More targeted specific research on this topic can really provide more clarity on the association between vitamin D and blood pressure. So I really hope that researchers continue to look at that connection. All right, well, thank you so much. The next slide just has a link to the paper, the actual written paper and the references. That is a PDF if you would like to look at it. All right, thank you so much.